Do you want a health policy that reduces costs and boosts positive health outcomes? Well, we can start by watching the short PowerPoint where you meet our nation's expert on iodine, Dr. David Brownstein. Dr. Brownstein has over 30 years of family practice experience as a medical doctor. He has written more than 30 books on medical issues, including the important book Iodine: Why You Need It, Why You Can't Live Without It. Dr. Brownstein's main message is that iodine deficiency affects 97% of the population in the USA. The standard lab test is not accurate, which is why most people do not know they are iodine deficient. Low iodine is the most important underlying cause of the 1 in 7 women destined to suffer from breast cancer in our country, and the 1 in 3 men destined to have prostate cancer, and the epidemic increases in pancreatic, uterine, and thyroid cancer. Our iodine levels are lower than ever, and our exposure to toxic halides like bromine and fluorine are higher than ever, making our iodine deficiency worse. Meanwhile, our government's health policy completely ignores this problem. One reason Dr. Brownstein can be sure about the iodine deficiency rate is that he and his medical group have done the iodine loading test on over 8,000 patients. The results show 97% of Americans are severely deficient in iodine. These Americans don't know they are deficient because the standard lab test will not show the true state of iodine in the body. The iodine loading test is done by administering a known amount of iodine and then measuring the amount of iodine excreted in the urine of the next 24 hours. If the body is severely deficient, the body will retain inside more of the iodine dose. Americans are asking Robert F. Kennedy Jr., the new Secretary of Health and Human Services, to contact Dr. Brownstein and ask him to draft a new health policy about iodine for the USAA. To understand better, let's compare 25 milligrams per day of iodine as iodorol that Dr. Brownstein prescribes for many of the patients he treats versus the U.S. government's recommended dietary allowance for iodine. The U.S. government recommends 150 micrograms per day of iodine for adults and for teens 14 to 18 years old. Dr. Brownstein, on the other hand, has treated thousands of his patients with 25 milligrams of a mixture of iodine and iodide daily. How does that compare? 150 micrograms versus 25 milligrams. It means Dr. Brownstein's patients are receiving 167 times more iodine than the U.S. government's recommended daily amount. To find out why Dr. Brownstein would do this, let's look at 2 scientific research studies. In the first, from the Biochemical and Biophysical Research Communications in 2010, we learned that so-called excess iodine suppresses what is known as VEGF, or vascular endothelial factor. That's interesting because VEGF is a protein cells can make and send to the surrounding cells to cause more blood vessels to grow nearby. Is having more blood vessels grow nearby a good thing? To answer that question, let's take a look at a second research report. This one is from Seminars in Cancer Biology published in 2022. Here we learn that VEGF is one of the key angiogenic or blood vessel growing factors in tumors. Not good. We also learn that VEGF participates in the initial stage of tumor development and in the progression and metastasis of tumors and cancer. If it sounds like suppressing VEGF might slow down a cancer in a patient's body and keep it from ever hurting the patient, well, now we see what Dr. Brownstein is doing with that daily 167 times more iodine for his patients. People may not realize how bad things have gotten over the last 30 years. Cancers of the breast, prostate, uterus, pancreas, and thyroid are occurring in younger patients. Part of the reason is that bromine is in our environment, such as used for fire retardant in mattresses and furniture, and there's bromine in our food, such as in bread. Bromine and fluoride interfere with iodine in the body, making patients with low intake even more iodine deficient. Doctors have been taught in medical school that there is plenty of iodine in salt, but then the doctors are told to advise their patients not to eat salt. Some doctors have discovered that earlier treatments using iodine, such treatments as from the 1950s, these older treatments worked well. But today's health officials discourage the doctors from using these tried and true methods. Americans have a daily intake of iodine only about 1/6 or 1/7 as much as the Japanese. That lines up with the higher rate of breast cancer in American women compared to the Japanese women, and the higher rate of prostate cancer in American men compared to Japanese men. Thyroid cancer also has a higher incidence in Americans than Japanese. In the USA, Dr. Brownstein is perhaps the most experienced medical doctor in using iodine in treatment. We need his help in bringing the current epidemic of cancer under control. Let's hope our health officials make the right decision and ask for Dr. Brownstein's help. Thank you.